Yeah, that's your question. I'm not gonna ask your question. But then I was Lorraine over there getting like she was going biggie with everything. I'm scared. I don't know.
We can hear this. Hello, and welcome to AGELESS Beauty Broadcast. I'm Dr. Anayo, and I have my crew here. Sitira, hi. Can you say hello to our audience?
Hello.
Candice?
Hello.
And we have Christina back online. So today we're going to be talking about a very, very important topic, bioidentical hormones, hormone replacement therapy. So feel free to call in. The phone number is 478-333-2595 and ask any question. You can DM us on Facebook, and we're live on WDDL 980. Okay? So, what are hormones? Hormones are what we have in our body that actually make us perform and do things that we're supposed to be doing. But anyways, as we age, as we get mature, I don't like talking about, as we age, but as we mature, we actually lose these hormones in our systems. And those are the things that actually make us function very well. So we're going to be performing live demonstration on how we can put these hormones back into your system to actually make you function very well. So Christina, can you say hello?
Hello.
Okay. So I'm going to ask Christina a couple of questions. Why she even wants to get this done. And then as we go along, we're going to be talking about who needs it, why we need it, and why should we even get it. So how old are you, if you don't mind?
46.
46 years old. Okay, so what made you start thinking about hormone replacement?
I think maybe it's because I've noticed a few changes. Like I feel like I'm a little more tired more often.
Mm-hmm.
I feel like my mind is not as clear. I feel like I get a little forgetful sometimes.
Okay.
Almost like I have like a cloud.
Okay. And she's just 46 years old. Okay, but you're still menstruating.
Yes.
Okay. So from age 35, we actually start losing some percentage of our hormones in our body. And by the time we get to our 40s and 50s, we have full-blown menopausal symptoms. That doesn't necessarily mean that you're menopausal. You're menopausal when you have stopped menstruating. But now you're actually in the premenopausal age, and the symptoms that you're having are premenopausal symptoms. Okay, what are those symptoms? You said fogginess, forgetfulness, fatigue, tiredness, insomnia, meaning not sleeping very well.
Sometimes I have a little bit of joint pain in certain
Joint
areas.
Joint pain, and some people get very, very moody, and some people actually get depressed. And there's going to be some hair loss.
Yeah, I've experienced that too.
Mm-hmm.
You've experienced some hair loss, head thinning, and then the lack of sex drive, whereby you just don't want to do anything. Okay, so if you want to get your mojo back, this is it. You have to check your hormones. And how do we do that? So we first started with getting some blood work done. Mm-hmm. So she had her blood work done about a couple of weeks ago. And this is not one hat fits all. Okay, so with the hormone replacement therapy that we do here at AGELESS Aesthetics, we use the bioidentical hormone. And what is bioidentical hormone? It's biologically identical to the hormones that is in your body already. So what we're doing is we're using some plant-based pellets to actually balance your hormones. Questions so far?
Why hormone pellets instead of the hormonal creams?
Okay, so the hormones that we use here at AGELESS Aesthetics is biologically identical to the hormones that is already in your body. So your body recognizes it and is plant-based. With the creams, it's plant-based, and plus when I told you, you have to get some blood work done, between the two, you still have to get your blood drawn. But with the pellets, it's actually customized to your own body needs.
So bioidentical hormones are safer than standard hormones.
Yes. So the standard hormones, which we normally get in, our OBGYNs or your doctor's office, mostly are synthetic. So they are pharmacologically made in the labs. These are still made in the labs, but the ones that we get, the pills, are actually synthetic. And I don't even want to go further. That will be another topic. But this is plant-based, and it's compounded to your own needs.
So basically, it's safer for the pellets to go into the tissues so they're not altered by the liver if you orally take them or put them on your skin.
Exactly. And plus, so with the creams, because the skin is the largest organ in the body, we don't even know how your body absorbs it. Okay, so if you have a dead skin on your skin, your creams might not penetrate, so you might not get the full benefits of the hormones. With the pellets, it works with your cardiac output, okay? So it works with your body. Your body takes what it needs when it needs it, and then when you're relaxed, you actually get a good relaxation, you get a good sleep, and your body.
So basically, pellets are safer to use than and more natural to use than creams and oral hormones. Okay.
Correct.
I have a question.
Okay.
Okay, so when you say your body takes what it needs when it needs it, if you do the pellets and say it doesn't need everything that's in the pellet, does it use it over a longer period of time, or does it like flush out through like your lymphatic system or something like that?
It uses what your body needs when it needs it, and it's released over time.
Over time.
So it's not like, okay, so when we give like maybe testosterone shot, your body gets the whole dose of it,
Mm-hmm.
and it doesn't know what to do with it. So it converts it to other things that you probably don't need. Okay.
So would you say even though every 3 to 4 months women come in to get these hormones, that they should do more frequent testing to make sure everything is balanced?
Yes. So when we pellet her today, in 6 weeks we're going to repeat her blood work, and then we'll see how balanced she is. If she needs to be boosted, she can be boosted, and if she's feeling fine, then we'll kind of go from it. Now, how long does this pellet last? It lasts anywhere from 3 to 4 months, depending on how active you are. And then I think I recommend 3 treatments, at least 3 a year, to really get the full benefit of it. Okay, I didn't even talk about weight loss. So the hormone balancing. Okay, so some people try to lose weight and they can't really lose the weight, and they're trying everything, they're working out, they're eating right, but they still can't get they can't get anywhere. Probably your hormones are not balanced, so you have to ask your doctor or go to your doctor to check your hormones. Once the hormones are balanced, especially once you have testosterone in your system, that will actually help with weight loss, because the testosterone helps with lean muscle, to build lean muscle, and it gives you energy, vitality, and all those good things. Those are the benefits of testosterone.
So the most frequent question that we get here in the office is how quickly does it work, and will they start feeling better? So I know sometimes you tell people, 2 to 3 weeks, you'll start feeling better, but just so people will also know, it also takes up to 8 weeks, like she said, depending on your cardiac output and your metabolism. So some people do feel the effects the same day, but some people do not as well, because of how unbalanced your hormones are.
Exactly. Z, you got it. Thank you so much for that. So we're going to be performing the live demonstration, and these pellets are inserted in the hip, or in the stomach, depending on how long you've had it or where you want it to be. But I kind of like favor the hip, because nobody's touching the hip. So, as far as the stomach is concerned, that really depends. Some people can get it in their hip because maybe muscle mass, but I would recommend the hip. So what other questions do we have? Okay, so what are the benefits of testosterone? A lot of benefits of testosterone. Men, women, we all need testosterone in our lives. Okay, I know the testosterone. When people hear about testosterone, they think of men's hormone. Yes, but women also need that because that really helps with a lot of things like weight loss, mood swings. It helps with hair growth. It helps with building muscle mass, and it helps with vitality, overall vitality in our lives. For men, they also go through what is called Angioplus, which is like menopause for women, and they get all the symptoms that I was talking about for women: mood swings, weight gain, especially around the loss of vitality, loss of sex drive.
This is not only for women, this is also for
Also for
men
men.
as well.
Okay, so what we're gonna do is we're gonna have you bend your knee and then just kind of like roll over as if you're kind of sleeping. So we have her hip right here. So call if you have any questions. The phone number is 478-333-2595. This is an in-office in and out procedure. Done within 15 minutes, you're done. But you have to have a full consultation before we even talk about any pellet insertion. So, here we go. Why doesn't my doctor, my general practitioner, talk about hormone replacement therapy? Well, I'm just going to say this. Some of the physicians are not comfortable with, especially compounded medications like bioidentical hormones. So you don't blame your doctor about that. You just find a practitioner that is well educated on bioidentical hormones. And of course, it's not all pharmacies that compound these hormones. It has to be a compounding hormone pharmacy. All right. So, any questions so far? So call us, make your consultation is area code 478-333-2595. I haven't even started. Okay, so we're gonna have a little quick.
This is actually a live procedure being done of how hormone pellets are actually inserted into the hip.
So I'm just gonna be numbing it. We're gonna start with numbing first, okay? So that we don't like pain around here. Okay, so you're just gonna feel a little prick and the numbing is going in, okay? Okay. So we'll make a little nick. Okay. Can you feel anything? No. Yes, no, maybe. I don't know. Okay. Make a little nick. This is how fast this is. Seeing it on camera looks a little invasive, but it's really, really, really not invasive at all.
Yeah, I don't feel anything.
And like I said, men can get this as well. So for the men, the dosing it's a little bit different, okay, because men need more testosterone than women. So how much of estrogen are we putting here?
10.
Okay. So with the bioidentical hormone with pellets, it's composed of testosterone and as well as estrogen. Okay. So when we put her in the system, in the dosing side, because like I said, it's all customized. It's not one fits all. So with her symptoms that she has and with what her body needs, she needed 10 milligrams of estrogen and then
112.5 of testosterone.
112.5. Yeah. And that would be different from what Z will get, and that would be different from what you will get. Okay? And like I said, we start losing our hormone from age 35. So by the time we get to our 40s, we've lost a significant bit of testosterone. and estrogen, of course. Now, I'm talking about menopausal symptoms, and that's it. So, how long did it take me?
And
10 minutes.
And Dr. Nair, how would I care for this when I get home?
So, okay, I'm putting what is called a Steri-Strip on top of your skin. Okay, so you're gonna leave it on for 3 days, and I'm gonna put a transparent occlusive dressing on top of it. So you don't take it out for 3 days, and after 3 days, you just leave the Steri-Strip on, and it will just fall out on its own. Okay, and your skin where I made the nick will close on its own. Now, there are some things that you're not allowed to do, like squatting, like gluteal exercises, like doing a bath, sitting in a hot tub bath. But you can shower, you can do all these things, and that will be fine. Okay. So let's do this. So we're putting this dressing on. And you're good to go. So, when would you start feeling better? Okay, it all depends on people, just like Zitila said. It depends on your cardiac output, your activity levels and stuff. It actually comes in cycles. So let's say you're feeling very fatigued, or you're not sleeping better, or you're having hot flashes. It could be your hot flashes. You don't feel the hot flashes anymore. That could be the first for you to notice, and then increase energy and stuff like that. So it just comes in cycles.
Okay.
But you should start feeling better within days, and then the next 2 weeks, by 6 weeks, you should be wow.
Okay.
What have I missed? What have I been missing?
What have I been missing? Yeah.
So another thing that we have to also talk about is how long should I get this? How long? As long as you can. Okay. I have people in their 60s, 70s, even almost 80s getting it. Depending on your activity level, depending on how much better you want to feel. Okay. Like I get the pellets, and I don't think I can go back. As long as I can walk and talk, I'll be getting the pellets. Okay. And how young can you get how young? Age is not the topic here. Why? Because some people actually go into what should I call it? Perimenopause, as early as 35. So, but the determination will be the blood work. You have to get a blood work, get your hormones checked before we even do that. And we don't just check the female and male hormones. We'll also check your thyroid. Make sure your thyroid is balanced. If it's not balanced, we'll still balance it for you. And it's all natural and not synthetic.
So if you're experiencing adrenal fatigue, foggy mind, poor sleep, and weight gain, all these are common symptoms of hormones being unbalanced, correct?
Yeah.
So the adrenal gland produces cortisol, which controls our response to stress. During times of high stress, whether short or long term, your ability to produce the proper levels of cortisol can be affected. And that's why a lot of people come and get the bioidentical hormone therapy. And like we said, it's not only for women, it is also for men as well. And in a time like this, us dealing with COVID and everything like that, people experience a lot of stress, and getting pelleted actually helps to balance out your hormones where you could, still kind of function with your day-to-day lives.
Exactly.
So call us to get pelleted or to come in and get a consult and talk more about the issues that you're having at 478-333-2595. So the pricing of the pellet for a female, the standard pricing is $350, and the pricing for males run a little bit more because, as she said before, we have to order quite more pellets in testosterone for males. So the male pellet pricing is around $700, and that is up to 1,800 milligrams of testosterone. Once you go over the 2,000 mark, then there is an additional fee, and it's just depends on how high.
How high? So with men, like with females, we pellet them with anywhere from 100 to 200 milligrams, as opposed to men that will pellet from 1,200 to 2,400 milligrams of pellet. So with men, I want to also address that, sometimes, as we age, especially from 35, we lose about 30% of the hormones, men. So every year you're losing your hormones. And then you have these symptoms that you don't even know where it's coming from: moodiness, mood swings, loss of muscle, not able to work out, things like that, just not feeling good. Okay, it's not that you're depressed. It's probably your hormones are not balanced. So you need to come to a physician. You need to get your hormones checked, and you need to get pelleted. Okay. So with the testosterone shots, which, some men like it because of the shot, you come and get your shot from your doctor's office, it's synthetic. And, okay, so it gets into your blood system, you have very high levels, and then you drop. And then you start feeling the same way that you were feeling before. But with the pellets, your body, your body takes what it needs when it needs it because of your cardiac output. So depending on your activity level, it's released into your system very slowly. So it's not like you have this high peak and then you drop.
So is it true that the synthetic testosterone shot affects the liver?
Okay, that's a good question. That's a very good question because it's metabolized through the liver. So
that's why it's more potent for you to stick to plant-based pellets versus getting the shots. We are not against the synthetic testosterone shot, but we do promote wellness, as natural wellness. So we are more for the bioidentical hormone. We are more for the bioidentical hormone than we are for the synthetic testosterone. It's the question. We do have a question, and it says, "Is this cash payment, or do you take insurance as well?"
This is cash payment. The insurance covers your blood work and your consultation, but because this is a compounded therapy procedure, your insurance doesn't cover it. Now, if you talk with your insurance and if it's medically indicated, you can still, work out something with them whereby they can cover it. But, most insurances
do not cover
it. So, yes. You have a question? Okay, so for men, how long does this last? It lasts for about 6 months for men, so you get it twice a year. And I promise you, if you get it, you're not going to go back to your old way of life, because now you're going to be, you have more energy, the vitality is there, you can slay a dragon. I didn't say that. I say you don't even get a promotion at work, but anyway, but at least you will have the foggy mind. And
right.
You will think clearer.
Right.
And you sleep better, so you produce better at work. Okay, so what other questions do you have?
Does anyone else have any questions?
Yes, and feel free to call us for any questions. Area code 478-333-2595. I think the youngest person that pelleted was 30 years old.
I think the youngest person that you was pelleted, since I was in the room majority of the time with you, was 26.
26?
Yes, she was. She was 26. So even though it does say that women start hitting perimenopause somewhere between the ages of 35 actually, everything starts going downhill when you start giving birth to children. So, and that is scientifically mentioned. So that, yes,
There's another question there.
someone wants. It looks like restring. The phone number is 333-2595.
Okay. And feel free to ask any question. Don't feel shy. I mean, this is a private conversation. So feel free to ask any question. Feel free to call 333-2595. Okay? And ask any questions that you may have. Okay, so, I mean, so you see, it wasn't painful, right?
No, not at all.
It didn't, I mean, you're going to feel sore maybe in a day or two, but that's it. But you're going to feel so much better, and you're going to just, okay, feel so much better.
Feeling better, all right?
Are you?
I don't know.
So, one question that someone did ask was, how does this affect your body when they're
Go ahead. No, keep talking.
when they are? Question: do you group appointments for company for GAPCO?
Yes, please, I do. And just put your phone number on there. Can you put your phone number on there, and we'll be ready to give you any presentation. And yes, we do group company consultation. So Z, can you get her phone number or his phone number?
Yes, if you DM
your phone number.
We're actually live on Facebook as well. So if you go to our Ageless Aesthetics page in Ronald Robbins, you should be able to actually send us a private message.
It's a group of 45 of us that would like to schedule. We watch every week.
Oh, thank you so much for watching, okay? And yes, just leave your phone number on. We'll contact you, and we'll set up a date whereby we can,
Accommodate.
yeah, we
You
can
all.
accommodate you all. So that will be awesome, because with wellness we need to know a lot about this. Because sometimes you don't get this. Some information you get on the web is not really accurate. So I will be very, very. I'll be happy to do the group consultation.
It says you look young and amazing. We'll call your
Oh,
office.
thank you.
So to go back to the question that was at hand was, how does this help acne, and what are some other things that will help acne?
Okay, so will this help acne? That's a good question.
If it's, I guess, hormonally based
If
acne.
yes, if it's hormonally based acne, some people have what is called PCOS, okay, polycystic ovarian syndrome, whereby they break out, they have facial hairs and other medical issues. It will help with that, because once you balance that hormone with the PCOS, your hormone should be improved. Okay, so but also one of the side effects, we didn't talk about side effects, which we're going to actually address later. You might break out a little bit, with facial hair or acne, but it actually kind of balances out itself as long as you get the hormones. As long as everything is balanced with the estrogen and your testosterone, you should be good. And I'd rather have acne or have facial hair than not be on the hormones. Okay. So thank you all for watching. This is Ageless Beauty Broadcast, and I'm Dr. Anayo Umerah, and I'll see you live next week. Okay? Any other questions? Okay, who gets the hormone and who doesn't get the hormones? Okay, so if you have a lot of cardiac issues, you have to clear with your doctor before you get that. I cannot do this procedure if you have an open wound, of course.